Hi everyone, welcome back from your break. I hope you all enjoyed it. I know that death by PowerPoint is such a real thing, so I'm going to try and get through this presentation so you guys can get home to your families. But before I begin, I would like to start off with some hard facts so as to paint a picture of why it is important that we ensure everyone has access to oral health care. Fact: approximately 1 in 4 children between the ages of 3 and 9 years old living in poverty has untreated dental caries. Fact: dental sealants were more prevalent among non-Hispanic white adolescents, roughly 56%, compared with non-Hispanic black adolescents, roughly 32%, between the ages of 13 and 15. Fact: among adults between the ages of 45 and 64, 29% had a full set of permanent teeth. This includes 19% Hispanic adults and 11% of non-Hispanic adults, and non-Hispanic black adults, compared with nearly 35% of non-Hispanic white adults. Now, I'm going to introduce you guys to the Healthy People 2020. So for those of you that may not be familiar, it's essentially a GPS that is directing the United States in a healthier direction. Their vision is for all of us, everyone here, to live long and healthy lives. They have 4 missions, which one is to identify nationwide health improvement priorities. Oral health is one of them. Increase public awareness and understanding of the determinants of health, disease, and disability, and the opportunity for progress. Provide measurable objectives and goals that are applicable at the national, state, and local levels, and to engage multiple sectors to take actions to strengthen policies and improve practices that are driven by the best available evidence and knowledge. Now, Healthy People 2020 has 17 objectives or goals as it pertains to our nation's oral health. In short, however, it's to prevent and control oral and craniofacial diseases, conditions, and injuries, and to improve access to preventative services and dental care. Now, some of you may be wondering, what does that have to do with the CDC and how can these goals be achieved? Well, by utilizing the CDC's strategic plan that I mentioned to you guys earlier, we can achieve the goals of Healthy People 2020. I'm going to give you a few examples. Goal number 1, Healthy People 2020's goal is to prevent and control oral and craniofacial diseases, conditions, and injuries. Well, our goals at the CDC are in line with that. Goals number 1, 2, and 3 is to prevent dental caries, periodontal diseases, and oral cancers across all stages of life. So again, as you can see, our goals are in line with theirs. Now, our strategic plan and how to reach these goals is to improve surveillance of these oral, craniofacial conditions and injuries, and 2, to develop, create, and promote a database for both strategies and interventions that have been proven effective against the conditions previously mentioned. Goal number 2, Healthy People 2020 has a goal to improve access to preventative services in dental care. That's in line with Goal 4, which with the CDC, which is to eliminate disparities in oral health. So our plan is to broaden the understanding of health disparities, determinants, and provide evidence-based approaches to addressing disparities in oral health. Health disparities may involve inequalities in health outcomes or receipt of health care services among different groups defined by their races, ethnicity, gender, health behaviors, education, income levels, and so on and so forth. The CDC will continue to focus on monitoring the burden of oral disease and the receipt of preventative services, and providing information to public health practitioners, dental care professionals, and policymakers on effective approaches to reducing and eliminating health disparities. These are just a few examples of how the implementation of our strategic plan will help both organizations reach their goals. Thank you all for your time, and have a good evening.